Hi. Okay, my name is Richard Matteucci. I'm with USA Mobile Drug Testing. We're one of the largest on-site drug testing companies in the U.S. Additionally, we are specialists in drug testing for DOT, non-DOT, workplace consulting around programs, policies. We also additionally do some DNA and some family drug testing. So if you have any questions on those, feel free to give us a call. Today we'll be discussing doing testing in the post-COVID world, and how you should be looking at doing testing around in the workplace, around the companies, and all those kind of things. But first off, I wanted to kind of touch base on some trending to give you an idea of what we're dealing with in the last 3 years. 2017, we saw a spike of about 7.7% increase in post-accident drug testing. 2018, we saw an 8.6% increase in positives for post-accident drug testing. And then in 2019, we haven't got a lot of details from the labs yet, but from here in Denver, we've seen a 9.5% increase in positive overall. And then additionally, we've seen about a 12% increase in post-accident positive results. So those kind of mix up, and most people think it's pot, but we've also seen additionally positives from meth, cocaine, and alcohol. So generally speaking, in the post-accident world, we're seeing increases. Those trends are continuing to increase. We're not seeing a reduction. We're not seeing anything that indicates that less people are using. Again, in reasonable suspicion, we're also getting a lot of data that's backing those assumptions up. We're not getting as many details around positives because generally speaking, reasonable suspicion is going to be a positive when we get the call. There's been several people that have done it. It's probably 9.5 times out of 10, that's going to be a positive. But we are seeing year-over-year increases around reasonable suspicion and the number of calls that we're getting to come out and do those tests. So in the pre-COVID world, we saw a trending of positives going up. We saw some other stuff. And typically, we were always talking about how it's critical to have a workplace policy. And the reason why you wanted those was to increase safety, make sure you're having security and you're keeping your security of your company on the highest level possible. And then those coupled together reduce your costs. In the safety terms, the U.S. Department of Labor has been quoting for several years that about 65% of all on-site job-related accidents are results of alcohol and drug abuse. Additionally, the workers' comp insurance companies and details are saying that 38 to 50% of all workplace accidents that go for workers' comp are related to drug and alcohol. Bottom line is, when people are impaired, they make bad choices. They're going to hurt themselves. They're going to hurt other people. Again, as I said, a drug-free workplace will kind of combat those. Security of the company, you're always dealing with, impaired people make bad choices. And so you want to make sure that you're dealing with those accident reductions, the errors of leaving doors open, cash registers open, those kind of issues that you're going to deal with when someone's not paying attention to security. Additionally, you're going to have those people that are making stupid mistakes. Like, for example, I had a customer that had a client, a marketing guy was doing some marketing work for Facebook, dragged the customer contact list and dropped it into Facebook. Had on his personal side, had he not been friends with some of the workers, that information would have been sitting out on Facebook. Direct impairment problem. We did a drug test on him and he was positive for pot and alcohol. So he was making those bad choices. And so the security of your clientele and your work sites are at risk if someone's impaired and working on your site. Now we fast forward a little bit and we're adding in people wearing masks, people trying to prevent exposure and infection spread. And those same people that are making those bad choices about leaving cash registers open are still making those same bad choices about not putting their masks on, not wearing them right, putting them under the nose, those kind of things. So what we want to do is you want to make sure that you're dealing with those issues, and those issues are going to continue to be on a rise. All those together, if we reduce those, you get a cost savings. And that's the beauty of having a workplace policy. Now, with those trends that I just kind of highlighted at a high speed, to make sure everybody kind of got them, you're going to be dealing with people coming back now. And this is a post-COVID quarantine phase. Those people are going to be dealing with stressors. They're going to be feeling the concerns of families losing work time, people having issues with job loss from spouse, financial problems. And that stress is going to add to their desire to have escape, which once you start seeing people in a stressful situation, you're going to start seeing people trying that escape through alcohol, They're going to fall back on drugs. They're going to fall into those old addictions. Many of them are going to pick up new addictions, and then they're going to have an additional dependency on those. And then those people are going to start coming into the workplace, and you're going to see that as we open up and we see more and more people, some of those coworkers that were straight as an arrow are now going to have an addiction and a dependency problem. So as we move forward into this open workplace, you're going to see issues, and you're going to want to have a protocol and a contact and a partner to deal with that. And one of those things is USA Mobile. You're going to have an operation that you can work together with us, and we can set up something to help you. We can be there for your support. The key, and no matter what you do, when you open a workplace policy, is you want to have the right approach that protects you, your customers, and your coworkers and employees. And so what you want to do is you want to make sure that you're contacting the right business partner. Now, before I go on further, I wanted to just touch upon two myths that we've been seeing come up in the DOT world. The first myth is that the DOT has suspended drug testing during the COVID and the post-COVID back to work operations, and that is false. The DOT has made it very clear that they expect drug testing to continue, and that if you're doing any kind of reopening around safety sensitive, you need to make sure you're instituting those policies right away, and that you're making sure that you're meeting the requirements. The other thing that we've been hearing a lot of is that if people are in homes and they're not kind of working right away, or they're not at the office, they don't have to be drug tested. And that is, again, completely false. If they are DOT sensitive, safety sensitive, and can return to work with no additional steps, then you want to make sure that they're in the random program and that you have a protocol to get them tested. Prime example is if you have a driver that's sitting at home and he's on call, you want to make sure that person's still in the random pool, and you want to make sure that that individual is still getting a drug test if they come up in the pool. So the biggest question is that's a lot of the stuff that's been going on in the world, but the bigger question is, what are we doing about people coming back to work and how you're going to do drug testing? One of the big things that you have to be cognizant of is you want to make sure that you're touching base with the human health services in your area. You want to make sure that you're understanding their rules and requirements. You want to make sure that you're touching base with national regulatory agencies to understand if they have any special protocols or any recommendations or requirements for your specific segment of the market. But in general, what you should be looking at is when you're dealing with vendors, customers, or employees, that you're talking about PPE, personal protection equipment. You want to make sure that those individuals that are coming onto your site, especially in a drug testing and mobile drug testing setting, that you want to make sure that they're using the masks properly, that they're wearing the gloves, and that they're engaging in the proper steps around those. They're putting the masks on, they don't have big gaps out the side, and that people are sitting there breathing and you can see the masks moving up and down, and clearly the air is not being blocked in any way, shape, or form. You want to make sure that you're engaging in those individuals before they're coming on site. You want to make sure that you're discussing, hey, if you come to do a drug test at our location, we need you to be wearing a mask. Those kind of things, or proper PPE. Additionally, you might want to be looking at doing temp checks. A lot of the issues that you're going to be dealing with is people coming on site. The only true way to tell if they're contagious is if they have a fever. That is the indicator that a person has a virus and that they're dealing with that virus in their body, and the fever is the temp check is the quickest way to do that. You want to also be making sure that your visitors and your vendors that are supplying you, especially your drug testing companies, are doing some kind of protocols around temp check to anybody they're sending on your site. Many of my companies that I deal with on a regular basis are large distributor companies that they've been essential for the last 5 months. And they've all moved into the visual thermometer, which is about this big, and it anchors on the wall above the door. And you come in, they direct you to put your feet on the footprint mark on the floor. And then the camera takes a picture of you and determines whether or not you have a fever. It's an infrared technology. I'm not sure what the pricing is on that, but for some of us, that might be an option. For others, it's a temporal check where you touch the forehead and then make sure you're wiping that down with an alcohol swab. Additionally, you might want to install a vendor filter. If you bring any vendors, including the drug testers, onto your site, you want to have that conversation before the routing to make sure that you understand, are they doing temp checks? Are there people been exposed? What kind of exposure checking are you doing with your techs before they come to my location? You want to be talking to them about outbreaks in the area if they've been exposed to those outbreaks. Additionally, you want to be asking about, does anybody have a fever of 100.4 or higher? Some of the areas are making that a little bit lower. Some of them are making a little bit higher. Again, check with your location. But here in the Colorado area, it's the general advice is 100.4 is the low-grade fever, and that's where you want to be concerned. Additionally, you're looking for the cough, the shortness of breath. Anybody, again, the exposure, what kind of exposure you're looking at. And then as they come onto site, you want to start discussing with them, how are you taking care of the surfaces around you? Are you wiping them down? Are you making sure that your stuff that's going onto our counters is protecting against our counter? Any kind of contact spread that you might be dealing with. Additionally, you also want to be looking at how they're disinfecting, what kind of stuff they're doing to disinfect. Are they using the proper wipes? We've had a case where someone was working for us and they were using baby wipes, and we had to take the baby wipes from the service, give them the proper wipes and the proper chemicals to make sure that they're actually disinfecting. Baby wipes don't disinfect. They just kind of get the stuff we want off the tushy, and it doesn't achieve what we're looking for. Again, additionally, once they come, you're going to also ask about their equipment. A good question to ask is, how are you disinfecting your equipment? One of the issues that we have to deal with is our breathalyzers. It's a little bit difficult to clean those from a perspective of not damaging the cells that do the termination. So the question is, are you wiping it down with alcohol? How are you doing that? We're taking the advisement of the CDC, and we're using ultraviolet light or sunlight, direct sunlight, to make sure that the disinfectants, they recently released that the half-life for the virus on surface in direct sunlight or in the ultraviolet is minutes versus hours or days. So we're using that technology around our high-tech equipment. Additionally, we're also using disinfectant sprays, materials that can be used to disinfect. Ideally, we're using the alcohol-based cleaners, and making sure that all of our stuff's done. Another issue that comes up in drug testing is the breathalyzer. How do you conduct a breathalyzer test? You kind of want to make sure that you're looking at the individual who's doing the testing and ask them, how are you going to do this test? For our example, we're taking the individual and we're standing them up. We're putting them next to us, so it would be here. And then we're holding our arm out fully so they're spread out as far as we can. We're putting the breathalyzer tube on, and we're directing the breath flow away from anybody that's in the area. You definitely don't want to have the breathalyzer and the guy's blowing directly through a tube that's directing his breath right out into someone's face or along those lines. We're looking for surfaces that can be cleaned after the breathalyzer has been used against the surface. Additionally, we're also wiping down the surfaces. We're keeping the chemicals away from the breathalyzer so it doesn't impact that. Additionally, you want to make sure that you're dealing with an area that can be maximum airflow, ideally an open air place that's not too confined with other people far away, so that we don't have that cross-contamination. You also want to make sure that the units are being cleaned. Again, you're asking how they're doing that, and that they're not affecting the damage or damaging the breath cells inside there that do the detection. And then again, when they're coming to you, you should be expecting these questions. That'll indicate to you that they're taking this seriously. They'll ask you those questions. How are you dealing with it? Are your people wearing masks? Are you cleaning surfaces regularly? Are you wiping down doors? Those kind of questions. Have you had an outbreak? Had you exposure? That's something that you should, as a customer, should expect the testers to be asking, or at least some kind of a filtration to make sure that they're not walking into a hot zone and getting the virus and contaminating others. So additionally, when they're coming on, you want to make sure that they're cognizant of social distancing. People are still habitual, and they still walk closer than the other people. The close talker is still going to try to be the close talker. Are the individuals coming around? Are they too close? Are they causing you problems? Are they making you uncomfortable? Then maybe you should have that conversation. And the time now is to actually have the conversation when it arises, so that they understand what you're expecting. We, as drug testers, most of us have pretty thick skin, and we appreciate the feedback versus, you never call us back because we made you nervous. Tell them, talk to them, and make sure that social distancing is taking place. And then on a side note, when you're dealing with clinics, it's very difficult to do this in clinics. There's a lot of exposure. Most of the clinics in our area are doing COVID testing. So now you're having your employees sitting in a waiting room, and then right next to them or across the room, there are some distancing procedures taking place. But I've been in a few where it's a small room, and there's, no matter what you do, there's distancing is not going to help. And so you have people sitting there. So before you send them to a clinic, you might want to reevaluate those same questions I just presented with social distancing and how they're taking care of the surfaces in the area. So generally speaking, for processing, So the processes that we're dealing with now, specifically in the DOT world, is that the DOT has made it very clear that if you are a DOT regulated employer, that you need to follow the rules and that you need to continue in the same process that you were before. If you're quarterly, you need to maintain quarterly. If you're monthly, you need to maintain monthly on your randoms. New hire, if you are doing new hires, they need to have that negative on file before they're doing any safety sensitive work. You want to make sure that those pilots that are required to have the negative before you even hire them, get those negatives. You want to make sure that anybody that's going to be touching trucks are still getting those negatives on file. That's the rules. And the DOT, FTA, FMCSA, all of them have made it very clear in different advisements that these need to take place. For random, it's the same as I've mentioned before with the myth. They are making it very clear that that individual, if they can get in the truck and drive, if they can touch the truck and do the work, they need to make sure that they are in that random pool and they're getting testing. They've made it clear that you need to make alternative plans for those, and that some of you, that they made it very clear in the statement that it should be random testing should have also a component of mobile drug testing available. They want the test done, and it has to be done under the protocols. Again, post-accident, most of us already do post-accident with a mobile service in off hours, and additionally, those might be the time to move post-accident all to the mobile service, so that you're not dealing with the clinic, because the clinics in our areas, like I said, are all doing COVID testing, so that increases your exposure as they go in. Additionally, reasonable suspicion, if you have the properly trained individuals in the DOT world, the supervisors making those calls, then you should be doing those reasonable suspicion tests if the individual shows those signs. If you have a shortage on those supervisors, you should reach out to us. We do have regular training that can help you out on that. Non-DOT, the random program is a great way to make sure that you're decreasing your costs around workers' comp. Again, 38 to 50% are all related to alcohol. So this is the time to start looking at and making sure that you're installing those programs and doing those drug testing. Consulting us, we'll be more than happy to help you on those. So that's kind of what's been going on for the last years. So what's the big thing that's going to change now is the big question. The big question, besides the PP&E and taking those steps and making sure you're filtering the vendors, you're also going to see a huge increase in the number of people that are going to come back and they're going to give you those signs that they've had alcohol or drug addiction issues or dependency issues. You're going to see the refusal test. Yeah.
Something comes to mind as you're talking about that specifically. We saw a policy today, right, with a company that had the same exact situation, and policy looks like it was written multiple years ago. And you mentioned having policies earlier on as you were kind of going through the process, explaining all this to us. But one of the things that I saw is I don't think people are really clear about their policies, right? So they're concerned, many states have recreational marijuana and medical marijuana on the books. And so are they dealing with that in their policy? And one thing that I saw specifically when reviewing that policy today that I thought was important enough to say now, as you're sharing what people should be doing as all of these workers are coming back challenged, was they had a written rule that said that an employee who fails a drug test can make a written request anytime in 30 days and have another test done. So, even though they're dismissing that employee for failing a drug test, they're allowing them a 30-day window to retest, which to me, obviously you and I are in the industry, it boggled my mind that someone would be allowed even an hour or 2 hours or 5 hours or the next day to retake a test. The DOT obviously, as you know, handles that with a split specimen, right? If somebody says, hey, I want something to be looked at, they're looking at a specimen collected at the time of the original test, right? Not something a week or 3 weeks later, but it didn't have any details, right? It was just a regular company, non-DOT manufacturing, warehousing kind of situation, but they had this huge loophole that any employee who fails. So I think that's an important piece right now as companies are kind of reevaluating those those employees and concerned about, they had half the workforce, if you're kind of a techie company, working from home, and now they're coming back to the office. And as restrictions, I know it's June 1st, have been, raised in lots of parts of the country, look at your policy. What does it say?
Yeah.
Maybe because of medical marijuana or recreational marijuana in your state, maybe you want to have a second chance, right? People are an important component of all those companies that we work for, right? Like the
Yep.
people themselves. And so they've invested a lot of time and money and energy into those people, and giving them an opportunity to have a second chance if they do over this period of time, the stress, right? I mean, that's definitely something that I've dealt with over the last couple of months with our employees and our customers and what they're dealing with their, hearing all the stories. Stress is a big factor for people. So, so knowing what your policy is a pretty critical component to talking to your drug testing company.
Exactly. I agree. Thank you, David. And I also think that we should also, on the topic of policy, they should also be looking at reviewing the policy. This might be a time when, if you haven't had a chance to review it and haven't had a chance to make sure and ask those questions, it'd be a good time to do that also, especially as people are coming back. It would be the time to introduce those changes in a clear, concise manner. So it would be a good point to do. And I agree with it. Thank you for that. Another thing that they should be also kind of churning while they're looking at those policies is how they're going to deal with the refusals. With the number of people coming in, one of the excuses that you're going to see with these refusals is, I don't want to go to the clinic. I don't want to be exposed to COVID. So you're going to see COVID kind of becoming that reason why they don't want a drug test. And so we recommend that the customers sit down and ask those questions about how they're going to deal with that. And our recommendation is to sit down and talk with the customer or the employee as soon as they say, we're not drug testing, I don't care. And the rule should be kind of, are you trying to avoid the test, should be in the back of the mind until you run down, well, we're going to bring in a collector. That collector is going to be using a mask or gloves. And then those problems should go away. You should answer all those questions and concerns about protecting the employee from COVID. If you go down that spiral of every excuse after excuse after excuse, I can't go, I'm not going to go to the clinic. Well, this guy might have COVID. How do I know he doesn't have COVID? And that continuing, then the employer should assume that employee is trying to avoid the test and kind of become more aggressive in saying, hey, listen, this has got to be done, especially if it's a DOT, and we got to do the test. And if you keep refusing, then this will be determined as a refusal. And I always recommend to my customers that if an individual is refusing, that if you can, the individual staying and they're not walking out the door, it might be a good idea to get a drug tester to come in and try to do the test. And at the same time, see if they can get the documentation, so you have a third party getting the refusal. So it's one of those things where with the COVID, you're going to hear this excuse. And generally it's going to be someone who had a legitimate concern, and that'll go away quickly with hey, we're going to get a collector to come in wearing a mask. Or it'll be the spiral that never ends. And then that's the person you have to assume is trying to avoid your test. Again, I have to make the note that ultimately, when it comes to a DOT drug test, the DER makes the ultimate determination under the regulations, and they have to go back to the regulations and follow those rules around removing from safety sensitive and those other issues that go along with that. Another issue that's kind of been alluded to before or stated before is that with the stress and all of the issues going on with our society right now, you're going to see increases of use. So you should expect the individuals coming back to work, or the individuals that have been stressed and been working, you should start looking for those behaviors that are going to stand out. They're going to be increased use at home. People are going to be having those issues with divorce. You're going to have issues with other stressors, and those people are going to start to bring those drug problems with them to work. They're going to be intoxicated. They're going to be impaired. So you should expect, it shouldn't shock you to see an increase in their staffing and issues with drug testing around, or drug use around those staffers returning. The question now is, what should you be doing as a customer, as a vendor, as an employer at this point in time, when you're dealing with this whole setup going through? What should you be planning for? As your employees are coming back, you should be looking to plan. You should be looking to monitor and kind of interact a little bit more. I know we have the 6 foot distancing, and masks are going to make it a little bit more difficult. Again, you're going to be looking for those strange behaviors. Granted, you're not going to be, shouldn't be too concerned about the guy who's doing the webinar in shorts. You should be worried about behaviors out of aggression and people doing issues with strange behaviors, aggression, having those classic signs of impairment, slurred speech, and all those things. The DOT world, you're going to definitely want to have those trained supervisors. The non-DOT world, You're going to want to have supervisors that are experienced. Additionally, we have training that's available periodically. You can contact us through our websites, and we do training for supervisors. If you're concerned about having someone that doesn't understand what they should be looking for, that's a different topic. We get a lot more detail in there. You should be looking at the local changes around you. You should be contacting the Health and Human Services websites on a regular basis. You should be paying attention to the reports about what's going on. Hot spots are another area you should be paying attention to. Recently here in Denver, we had the regional center that touches all the mail in the city of Denver had an outbreak where it was something like 320 people out of 325 came up positive for COVID in the area. So there was a lot of discussion about how to treat your mail before you touch it, those kind of things. Again, that would be one of those, if you have a driver that's going into that area, you need to make sure you're taking those steps, looking at the options around quarantine, self-quarantine, at least additional screenings of that individual for testing according to the regulations in your area. Also determined by what you do, what your driver is exposing other people to, or deliveries exposing other people to. Again, additionally, you want to make sure you're paying attention to the national level. OSHA just put out a bunch of information about what they expect and what they're looking for companies as they open back up and what their expectations are. Our guys here in Colorado, our Health and Human Services and our governor have been very good and diligent about telling us where we stand on certain areas. Mayors, we have 4 different cities in the metro area, and all 4 of them have a different rule from their mayor. The south side is wide open, and Denver's still wearing masks and under restrictions. So those are going to factor in. Those are things you need to monitor. Additionally, I always make the recommendation to my customers that you should plan all of your responses based on that one key employee you can't live without. If you have an employee that you look at that guy and you say, there's no way I can survive without that person, then you need to make sure that all of your policies and all of your behaviors are based on what if he turns up positive or she turns up positive. That's the individual that will cause you to pause and change and open yourself up to issues that you don't want to open yourself up to. So we always recommend that you want to make sure that you're putting those people as your primary determiner of how you deal with your policy. DOT is a little bit easier because they made it very clear what it has to be. Non-DOT, you have some leeways in most states, and you should make sure that you're paying attention to how you would handle that situation. Additionally, you want to make sure you're engaging with a plan. I would be recommending right now that you have your normal testing procedures, and then you also have 1, maybe 2 post-accident reasonable suspicion vendors that can come in who can also step in and help you do new hire collections, random collections. I would make sure that you always contact the local USAMDT office near you or our headquarters and try to get an engagement with us so that we're there to make sure that we can support you. If we don't know who you are, it's a little bit more difficult to deal with you. If we have you pre-set up, then we can make sure that we're helping you out. It gets us an opportunity. And generally speaking, it's my experience that USAMDT guys usually answer the phone. I shouldn't say usually, we answer the phone. Most of the time, other vendors are calling us to help them out. So again, the question I'm going to ask is if you're going to go and you're going to continue your drug testing, or you're going to bring in drug testing, why would you want to send them to a clinic? And that's because right now, everybody, and I'm all the major vendors that do clinic work are doing quick COVID testing, and they have lines out the door in some cases. In downtown Denver, there's 2 major national clinics, and they have lines, and it's all COVID. There's no one there for drug testing. There's no one there for doing workers' comp evaluations. It's all COVID. So you're going to be sending your employee into a location with 30 people waiting to figure out. So that brings me to my last point. Mobile eliminates your people sitting in a lab. That's what it comes down to. And speaking for our company, USA Mobile has always made a focus on making sure that our employees and your employees are treated safely and respectfully, and that we make the steps that ensure that we're doing everything we can to prevent anything that's going to hurt your employee from a COVID standpoint. And when we're on site, we're always checking to make sure we're in safe places, and we do everything that we can to make sure everybody's safe when involved. So at that point, I'm just going to give you some contact information. Our 800 number for the national office is 800-851-2021. Again, 800-851-2021. A great source of information and a way to contact us again is usamdt.com, usamdt.com. And then our local branch here is 720-287-0982. So thank you. And if you have any questions, feel free to email us or call us, and we'll get back to you as soon as we can. The fastest way to get a contact from us is denso, DENSO, info at usamdt.com, or Richard.Matteucci at usamdt.com.